Hello class, I will be presenting on my DNP project which touches on combating childhood obesity in the psychiatric population. Committee member Dr. Robin Hendricks, Maryville University, is my chair. Second reader Dr. Marilyn Riley, Maryville University, and my community person is RN Stephen Conricky. Background: obesity affects millions of children globally, affecting their health and social life. In the US, 40% of the population is obese. Adolescent obesity has quadrupled since 1990, affecting about 160 million children. The US Food and Drug Administration has approved treatment options for obesity, including medication and bariatric surgery. However, without appropriate intervention, obese clients will not become aware of these treatment options. Now, therein lies the problem. At the mental health clinic, children are not being diagnosed or referred for weight management services. But we can help with that. Evidence-based research is needed to influence clinical practice, with nurses responding through research and national networking. DNP students can develop protocols that empowers healthcare providers to intervene more frequently. The study was conducted at a mental health clinic with the aim of evaluating pediatric psychiatric clients aged 6 to 18 who were screened for obesity, which can help identify obese clients, prevent treatment with high risk weight gaining psychotropic drugs, and ensure referrals to primary care providers for specialized weight management services. Integrated literature review. The research on pediatric obesity highlighted themes like obesity identification/diagnosis. There is a link between obesity and mental health issues in children. They both need to be treated. High-risk weight-inducing psychotropic drugs. In practice, these medications are characterized as neutral, low risk, medium risk, or high risk weight gainers. The strategy encompassed switching prescribed known high risk psychotropic drugs such as olanzapine, Seroquel, clozapine, Symbiox, mirtazapine, amitriptyline, imipramine, doxepin, Paxil in obese minors to low risk psychiatric medication that reduces weight gain. Motivational interviewing. Client, family, and providers engaged in a natural conversation about referrals. Motivational interviewing techniques were vital during this visit. Theoretical framework. Walter Schuhart developed the Plan, Do, Study, Act (PDSA) cycle in the 1920s as a rapid cycle improvement methodology. It involved planning, implementing, studying, and acting on results. The process starts by identifying a problem, creating a plan, collecting data, assessing the outcomes, and acting. Its goal is to establish a relationship, a beneficial relationship between process changes and outcomes. For instance, the plan for screening, diagnosing, and referring obese minors entailed developing and implementing protocol via training healthcare providers on the procedures. The study analyzed percentage of patients diagnosed and referred for weight management services and evaluated whether the targeted goal was met. No action. If the goal was achieved, the plan was adapted. If not, the protocol would have been adjusted. Methodology. The study, a retrospective chart review, analyzed obesity data from patients' EMR using the U.S. Preventative Task Force 2024 guidelines, the automated quality measurement screening tab, which regards weight, height, and body mass index (BMI), was useful for pre and post intervention data. As mentioned earlier, the study was conducted at a Midwest Community Mental Health Center. I chose this QI, or this Quality Improvement Project, because it was non-human subject research that could have been completed within the allotted time frame. It focused on data from weight management interventions between May and July of 2025, which helped address the inquiry. No noted exceptions to confidentiality disclosure were applicable, as there were no active participants involved in this study. On the slide, you can see an image of the data collection sheet that was used. Sample. Descriptive statistics are powerful tools in medical practice. The study involved EMR of 12 patients with BMI at or above 95th percentile for their age and sex. The sample consisted of 80% males, N equal 9, and 20% females, N equal 3. The rural outpatient setting justified the chosen sample size. If you look at this slide, you see a graph with the percentage of gender participants. Should I say EMRs used in this study? Data analysis. Data analysis employed nominal measurement levels with careful variable identification and labeling. Data collected to assess obesity, diagnosis, and weight management referral showed differences before and after implementation, analyzed via the Z-test and chi-square test. Now, the testing permitted the comparison of the pre- and post-group data. Results. Before the implementation, no patients had obesity diagnosis in the AMR, but afterwards, all were diagnosed and referred for weight management services. Additionally, 5 clients on high-risk weight gain and psychotropic medication were switched to lower-risk alternatives. The results indicated improved diagnosis and referral rates, suggesting a positive impact on patients' health care. Limitations. The study identified areas for improvement, including inaccurate weight, height, and body mass index classification, weight and height measurements, body mass classifications, which were later corrected. The study limitations had limitations, including small sample size, time constraints, and methodological limitations. Even generalizability was limited because the sample was drawn from a single healthcare center with fewer children than the national average. Discussion. The project faced challenges due to increased telemedicine use post-COVID-19. This led to fewer inpatients or in-person face-to-face visits and resulted in rescheduled appointments that delayed data collection. However, the study protocol successfully minimized data loss. Psychiatric providers can contribute to obesity prevention and management. The studies emphasizes the importance of obesity intervention in non-primary care clinics for accurate diagnosis, documentation, and referral of obese clients. Together, we can make a dent in the fight against the national problem. The DNP study findings can enhance future clinic care. Implications. Nurses play a role in understanding obesity. We should develop targeted interventions, advocate for policies, educate clients about weight management strategies, advocate for intensive behavioral interventions, and foster referrals. The health team is crucial for managing obesity and its related health issues. Continuous accurate screening can improve clients' health and quality of life, benefiting not only the client but also the family, their families, and communities. By tracking obesity, practitioners can better address the diverse population needs and contribute to their well-being. Conclusion. The study emphasizes the importance of psychiatric practitioners addressing obesity, collaborating within the system. It aims to evaluate the effectiveness of obesity screening for children in the psychiatric setting. The research suggests a multidisciplinary approach to combating the issue. Tackling obesity demands an all-hand-on-deck interdisciplinary tactic. The project significantly expanded my view on the delivery of healthcare. It expanded my understanding of the multifactorial nature of childhood obesity. The impact of this study has led to a new policy at the clinic. The body of research illuminates the urgent public health crisis posed by rising rates of obesity. If given a chance, I would advocate for more inclusive research that accommodate diverse populations and explores cultural factors. Going forward, I plan to engage in transformative health initiatives to address not only childhood obesity, but also adult obesity. The DNP program has transformed my views on care. I have gained essential skills in evidence-based practice, leadership, healthcare policy, and advocacy. The program has highlighted the value of holistic approach to client care, connecting research to clinical practice. In summary, my DNP journey has enhanced my understanding and provided me with the tools to promote positive changes in public health. So I will say, by working together, we can definitely make a difference in this obesity epidemic that we face today. Here are my references. I want to thank you guys for giving me some of your time and attention. And I hope you do experience a better winter on your side of the country. Thanks again.